I'd like to acknowledge the local custodians of the land in which we meet today and honour elders past, present and emerging. Welcome. I'm Melissa Wilkinson from the education team with the Primary Health Network. If you have any clinical information, I strongly urge you to refer to the health pathways that are an excellent resource, and they're currently on your screen. They're updated regularly, and I strongly encourage you to have those for any clinical content that you may be needing. Right, we're going to have a question and answer section at the end of the seminar, so you'll be able to put your questions in. We encourage you to do that to be as interactive as possible. We have John Bailey with us today, who's our Executive Manager at the Hunter New England Central Coast Primary Health Network, and he'll be online to answer any questions. If we don't get to your questions today, we will endeavour to answer them via email. So if you just submit those to hneccphn.com.au, that would be amazing. Just some housekeeping. We are being recorded today, and this will be available in the Education Library on the website. There will be a poll at the end of the session, and we have the chat box on the right hand of your screen. We encourage you to pop your questions in there to be interactive as possible. I'm going to now hand over to Hannah Lane. She's our presenter today. She's going to take us through the immunisation tracker tool. Thanks, Hannah.
Thanks, Mel, and welcome everybody. Today I'm going to talk to you about our tool called Capacity Tracker, in particular about how we're using it to manage and monitor the COVID-19 vaccination operations. So we're going to start off by having a quick look at what is Capacity Tracker. Essentially, it is a free online tool that enables general practices to quickly and to easily communicate with the PHN about any issues that currently or potentially impact their operations, and it helps them to then activate PHN support. This is a little overview of how it works. Essentially, GPs and also AMS and RACF can register to use Capacity Tracker. Their details submitted are matched with our PHN records in our database, and once they're approved and the details match, they are authorised then to be able to update their status anywhere, anytime and on any internet connected device, which means that they can communicate with us through that system from that point on. It usually takes about 1 day to review and approve those details, but I will just put a note here saying, just please make sure that you keep your contact details up to date with the PHN so that there's no delay when we're looking to verify that you are the right person to be giving that information for that practice. Capacity Tracker then allows the users, the authorised users, to submit different kinds of alerts, red, amber and green, which require different levels of response. So there are 4 types of alerts. There's overall sort of general operational issues. There's PPE, prompting a need for additional resources, for example, such as masks. There's workforce alerts, and there are now vaccination alerts, which we'll look at in more detail later. We will firstly look at some of the success stories, and then I'm going to talk to you about some of the latest developments in Capacity Tracker. So the PHN has responded to many Capacity Tracker alerts, and the data that's been provided by the practices and residential aged care facilities across the region has helped us to address some staff and resourcing shortages across our region. These are just 6 examples, but as you can see, it ranges from being able to fast track locums or GPs, to dispatching masks, to ensuring that there is coverage for patients in regional areas, alerting our emergency operations centre about a fire in a practice, and it now enables the oversight and management of vaccine distribution. So as you may be aware, there was the opportunity to support the practices by redistributing influenza vaccines last year, and that's something that this tool will also enable us to do if and when that's required. So I'm going to talk briefly about PPE requests. So this is a new functionality that is now available in Capacity Tracker. For those of you who have registered, it's available under the Business Continuity tab. Essentially, as you see there, essentially we're asking that you firstly show on the red, amber and green status that you have a problem or a shortage, and that then you go to the PPE image below and complete the request form. So this should only be done where you don't have access to commercial supply, and they will be reviewed by the PHN, and then supplies will be made available if the request is approved, and they will be distributed by your normal PCIO. So just a reminder that then the status should be reset to reflect the current situation, which is that the supplies have now increased. So that is a new feature and function that has recently been introduced into Capacity Tracker. Additionally, however, the big new feature that was just introduced late last month is this vaccination module. So that's what we're looking at to monitor vaccination resources, both the stock levels and the immunisers, and also the number of vaccinations completed in some cases. Understanding how many people and staff, and in residential aged care facilities, the residents have been vaccinated and the percentages thereof, the number of doses available and doses on order and so on. All of this information helps us to have oversight and to be able to help manage the vaccine stock levels and locations across the region. And just a reminder that if you raise an alert, that will activate our support as well. So this is a bit of what it looks like. This is the GP providers page that you may be familiar with. Here is the new vaccinations page. So your practice name would appear under the provider section there, and now instead of just having one link to the business continuity page, there'll be a second one that will point you to the vaccination page. When you get there, at the moment we're only showing the COVID-19 logo, but we are currently working on the influenza and pneumococcal forms as we speak. So soon we do expect that there will be more than one vaccination type to select from at this point. So you click on the one that's appropriate for what you're making the update for. In this case, it's the COVID-19 data, and it will take you through to the form, which asks you what is your vaccination operation status. So are you able to vaccinate successfully, or is there some kind of operational problem? And there are definitions when you hover over each of these to guide you in assessing what the appropriate colour should be. And then if there is a problem or a concern, you can actually give us the reason below. So we've put in a few examples. There's also an other space, and clearly the more information that you can give us, the more we can look at how we can help and respond to you and what we can do. So that I definitely encourage you to tick as many of those as is applicable, and to give as much information as you can. We then look at the number of doses available. Now, as you can see at the moment, it's showing a few different examples that you won't necessarily have access to as yet, either because you're not administering them or they're not yet approved by the TGA. They're just labels at the moment, and they will be displayed or hidden or amended as required over time. But essentially what it does is it means that we can in one place capture all the doses you have available and have on order of multiple different vaccine brands. And because this form is going to be slightly amended but essentially replicated for influenza, for pneumococcal and potentially others in future, it's just to show you that we can put in different makers of different vaccines and have the overview there of everything you have in stock. And that then asks for your status. With that level of resources in mind, is that sufficient for you for the upcoming, I think it's 10 days of vaccinations? So it's asking you to consider what you've got booked in and whether you've got sufficient supplies, and just keeping an eye looking forward for that. We're also interested to understand whether you've got sufficient vaccine storage and if there's any need for assistance in that regard. So that might be in terms of the temperature, the power, or even the capacity. So again, you can raise those alerts and let us know that you might need some help with that. And when you make any changes to any of this, even if you don't change the alerts, you'll get a notification there that the vaccination status, has been updated, just to confirm that. So what you need to do at this point, if you haven't yet registered for Capacity Tracker, I encourage you to watch the short video that helps you to understand how to register and get set up. The PHN, once you register, as I said, it usually takes about a day to verify and set you up and confirm your details in Capacity Tracker. So make sure you've let us know if there are any changes to your contact details. You can then, do that and then register for Capacity Tracker, and that will help to prepare for the vaccine rollout. We will notify you when that registration is complete and you're ready to be using Capacity Tracker. If you're already registered, or once you get to that stage, just make sure that you can log in. So you might need to reset your password if you haven't been in there for a while, and there's a link to do that on the screen, which and the slides will be available afterwards, obviously. We'll ask you to just double check your organisational details and make sure that you keep them up to date as well. And then quite critically, it's important to log in at least weekly and to update these different tabs with different status. And as you can see in the green little speech bubble there, it's really important to do that even when things haven't changed. So you might be aware that there's no difference in what you're reporting between last week and this, but we don't actually know whether, and there is no change because your data is the same, or there is no change because actually the person who normally does that was away and didn't get a chance to do that, or someone hasn't written it into a checklist of things to do each week. So we want to be sure that the data is correct and up to date at all times so that we can use that to the best of our ability and to support the practices as well as possible. So we encourage you to keep essentially logging in once a week, having a quick review of that data and saving it to indicate, yes, if nothing's changed, we confirm that nothing has changed. I've also included there a weekly checklist, which just walks you through it's a one-page, very simple walkthrough of the things that you need to check each week. So it's things like just double checking the organisational details are correct. There's no change to, say, the numbers in any of the business continuity sections or workforce or staff, and then looking at the vaccination details, whether you have PPE resources and so on. So if you need further information or want to find out more about Capacity Tracker and how it can be of benefit to you, I encourage you to talk to your primary care improvement officer. I've also included there the PHN Capacity Tracker webpage link, which has some overview information and includes some videos and links. There's also a page called the COVID-19 Vaccination General Practice Preparedness page, which has been prepared by our PCIO team that could be of help to you and assistance as you're preparing for these vaccinations. And if you're after clinical information, as mentioned at the beginning, I just encourage you to refer to the Health Pathways sites, and they're there with the Central Coast link on the left and the Hunter New England link on the right. So that was all I was going to share as an overview of Capacity Tracker and its new vaccination module. So I'm just going to click over now to questions and answers slide.
Thanks, Hannah. Okay, so the first question that I had that was received prior was, how will Capacity Tracker data be used?
Okay, so like I mentioned when we started with the success stories, we use it to understand the situation and how we can help. So it might be that someone raises an alert saying their PPE is red. They've suddenly realised they're out of supplies, and the supplies that they ordered are not going to arrive for a week. They have a high level of people with respiratory issues and illnesses, so they might raise an alert with us to indicate that there's a concern or a problem in that area. They will tell us the information, as I said, in the form, and that then enables us to look at, well, what do we have that we can help with, and how do we support the practice in that way. So if we're aware of having access to the national medical stockpile and being able to source some additional mask supplies to tide them over for that interim period, we might be able to arrange that quite quickly and get someone to deliver them a box of masks. So that's just one example. Alternatively, it might be a resourcing issue, and there was an example where one of the GPs was caught out by recent border closures, and so we were able to support the practice in sourcing an interim GP so that the residential aged care facilities that are supported by that practice didn't get left in the lurch and still had someone to attend to their needs. And obviously in vaccines now, we're looking at the same sorts of things. What information can we provide? How can we help directing people to the right places, potentially looking at supporting the vaccine transfer and supply if necessary, and so on.
Okay, great, thank you. How can I register other people in my practice to use Capacity Tracker?
Okay, that's a good question. So it's a fairly simple registration process, and each person registers independently, so they can just go to that same registration link, put in their personal details, so their own name, not the practice name, and so on, and then it asks them what practice to be linked to, so then they choose the practice at that point. That will be verified, as I said, against our database records, and so we just make sure that that person is actually an authorised representative of your business, and then once verified, they are able to access it and make updates.
Great, thank you. Who do I contact if I have a problem or question?
Well, you can probably email through to, there's an email address called PHN Capacity Tracker at hneccphn.com.au, or contact me through yourself, Mel, or our IT people can also provide support depending on what kind of a question it is. There's also obviously the web page that I pointed to. For clinical information, there's health pathways, and there's a number of other resources. If you actually go to the Capacity Tracker page itself where you register, you don't need to be registered, but if you look under the menus, there is a link to the registration video that I put in my set of links. And so you can just go there and watch that first if you'd like to get an understanding of all of that. And of course, the main thing is each of the practices has a PCIO attached. So definitely speak to your PCIO. They can walk you through all of this. We have the checklists, we have presentations to share with you.
Okay, and I'm just going to repeat that yes, the webinar is recorded and it will be available to access later through our website and the Education Library. So what about planned capacity changes, for example, annual leave, where there's sort of no choice and they've got staff off, a number of staff off? How would that be best handled?
That's certainly something that might be reason to raise an alert also. So if it's known and if resourcing is an issue, certainly raise an alert, tell us as much information as you can, the duration that the person will be unavailable, what role they're performing, and what support we can help you with, and we will certainly endeavour to do that. So your PCIO will be in contact and support you, point you in different directions, maybe be able to source some additional resources, and reach out to other practices to see if there's a way to share or to support that workload so that people don't lose a primary care contact.
Great, thank you. When do we log into the portal to get started?
As soon as you would like, provided that you are registered. So if you're not registered, please go now and register. We're here to support you in that. If you are, you can go and log in right away and verify your details. If you've forgotten your password, you can click on Forgot Password and you should be able to get a password reset quite shortly.
Okay.
Just to be really clear that what we're talking about is registering for Capacity Tracker, not for the National Vaccine Ordering System, which is a separate system. That system is for ordering of vaccines through the Commonwealth Distribution Network, and you will receive your site registration codes 1 week prior to your anticipated start date. So again, just to be clear, we're talking about Capacity Tracker here, not the National Vaccine Ordering System. Just to answer the question in relation to we seem to be duplicating the national system. The national system is really for ordering and ensuring that the Commonwealth provides you with supplies. Capacity Tracker is designed so that we can help you on the ground. If you have an issue, or if there are for example, if you have a week where you have a couple of practitioners off ill and are not able to meet your weekly vaccine administration targets, then you can alert us through Capacity Tracker and we can negotiate some changes with the Commonwealth. Similarly, if you have other issues that are not related to the delivery and supply of the vaccine, we often can work through those with you.
Thanks, John.
Okay, so if anyone else has got any questions, please feel free to pop them into the question box and we'll get to them. So we've pretty much covered. There is another one about vaccine stock usage, accessing the information from the hub, data entry as the COVID vaccine education modules.
Yeah, that's the one I just answered.
You've covered that, haven't you? Yeah. And that's about it. There doesn't seem to be any other questions coming through on my end. I'll just give a couple more minutes, and if anyone else would like to pop a question in there, please feel welcome to. And I'll just reinforce that, yes, it will be recorded and available on our website.
While we're waiting for any last minute questions, Mel, I might just alert people to an email that we sent out this morning for practices to register interest in receiving a barcode scanner to assist with the serial number and batch code recording. So if you haven't seen that email, can I suggest you have a look at your email system and respond? Let us know, particularly if you're a first week practice, if you'd like us to supply you with a scanner, with a barcode scanner. It will make it easier, particularly as you move from week to week where the batch number will change. So really important that you have a look at that, have a think about it. Both MD and BP have the capacity to have codes scanned into them, and we've tested and have obtained a supply of those scanners. So please have a look at your email inbox for that email that came out from Jason Ruminek this morning.
Great. Okay, well, if there's anything else you'd like to add, Hannah or John, before we close, there's a few more questions coming through. So
sounds good.
Okay, thanks for coming today. Thanks for the presentation, and thank you, John, for coming in, stepping in to the presentation today as well. We really appreciate it. Thank you, everyone. Have a lovely afternoon.